So I know none of you have to take a break. If you want to stand up and leave, it's all right with me. I will tell you that I told the Board of Governors yesterday that insurance touches every bit of your life. From before someone's born until they die, you're going to be involved in insurance, prenatal care, burial insurance, and everything in between. So we're there. General Collins, what you talked about on infrastructure, you can't have infrastructure or construction companies if they don't have surety bonds. So we're right in that mix with everything. We can't do anything today on claims without technology, Haley. You understand when you're sending a drone out to look at some of the catastrophic events, you've got to have technology. But my message to you is going to be very quick. One, many of you have heard in the press that we have problems maybe of raising dollars to keep rates low on the Gulf Coast after Katrina. House Bill 1500 was shepherded through the legislature in 2007 with the help of Senator Dean Kirby. I know he's in the room here, and Haley Barber. And that bill specifically said that rates on the coast would be held not to an artificial level, would be held to a level where you could have economic development on the Gulf Coast. There's a lot of funds that go to that particular bill to keep rates low. They're called non-admitted fees. They're fees that are collected from surplus lines companies, $18 million a year to be specific. There was a move by the legislature to take those fees away from the wind pool. I was able to cut a deal. I think I'm legal. I hope I am. It's a quid pro quo. I'm telling you that up front with the lieutenant governor to keep $8 million in the fees, in the wind pool to keep rates level, and I gave him a commitment and a written letter that fees would not go up in the wind pool during the year 2022. Why is that important? Y'all ought to clap for that. My God, that's a big deal for us. Why is it important? Well, you're looking at the NFIP rates going up about 18%, and then you look at what you're trying to do to keep rates fair and equitable on the coast for the people that live there. It's a big deal for us. I'm going to quit talking about that and talk about the other things that's extremely important to you. Talking about keeping people in the state of Mississippi, scholarships and all the other programs. I took a lot of heat on some campaign contributions that had nothing to do with Medicaid, but the guy that gave them to me used to work for me. He was the CEO of the company. And I said, Aaron, you know what I'm going to do? And he said, do it. He said, we don't want the money back. We gave $100,000 to Ole Miss and Mississippi State for their insurance programs and for scholarships. And the folks, that's big. That's a tenth of what you're giving us, right? You ought to up your take anyway, Alan. It's important that we have young people that stay in our business. The Rural Fire Truck Program provides low rates for folks that live out in the counties and the cities of this great state of ours. I told the Board of Governors yesterday that every time you have a rural fire truck, if you live in a rural area, your insurance rates stay low, one, and number two, you have the ability to save somebody's life. If you live in the city of Jackson, you have a $100,000 house, you're going to pay about $600 a year for your insurance. You move out of the city of Jackson into the county, and your rates are going to go to a Class 8, and they're going to go up to $1,200. And if you move way out into the county where there's no rural fire trucks or volunteer efforts, your rates are going to go to $2,400. We can quantify of the $54 million we put into the program of rural fire trucks since 1995, the state of Mississippi's taxpayers have enjoyed over $1.8 billion in savings on insurance premiums in this state. Nobody, no tax cut, nothing can compare to that many dollars being put back into the pockets of the taxpayers and protecting lives at the same time. It's extremely important, not a lot of dollars involved, but it's extremely important that we keep programs like this funded. Because if you don't, you know where the money's going to come from? The cities and the counties have got to raise their millage, and that's not good when we're talking about tax cuts. I'm normally not in the fray on tax cuts, but I do want to say this. I certainly support a tax cut for the great state of Mississippi, and I am in the speaker's corner when we talk about trying to cut taxes. I'm in the lieutenant's corner on it. How they do it is up to them, but we do need some tax cuts and release for our great citizens in the state of Mississippi. Very quickly, we have an EMT bill working through in cooperation with the community colleges. that will allow us to continue training emergency medical technicians and paramedics. We train a lot at the State Fire Academy in incorporation with the community college programs in the University of Mississippi Medical Center. Why is that important? Because today, if you are an emergency medical technician or an EMR or a paramedic, you cannot be on a fire truck in practice because the law doesn't allow it. So we got a bill working through to allow people to at least get on a fire truck. If you want to volunteer as an EMT and live out in the county, you can practice being a paramedic. Today you can't do that. So that's a big bill for us. That's health care. And you got problems in the Delta with the health care, that brings up telemedicine. We issued a bulletin in March of 2020 saying to the insurance companies, we're going to have telemedicine. We don't tell you how much you have to pay for service on telemedicine, but you got to have parity in service. That's extremely important when people could not go to the doctor because of COVID-19. It's important when you have mental health issues and people need to have counseling. You can do that by the phone. You would think it would be a no-brainer to pass a bill like that to allow telemedicine in the state after COVID-19. I'm still working on it. I said a lot of prayers last night after I talked to the Board of Governors, but basically to say, Lord, help us do the right thing, what we're trying to do. We need to pass bills that will allow us to address infrastructure growth, education, and healthcare in this great state. People are not coming to our state if they don't have healthcare or access to healthcare. I see my friend Shane Speeds out in the audience out here, Chair or CEO of the Northeast Mississippi Community Medical Hospital. I applaud them for what they've done. They've been able to grow their communities in the northern part of the state through having a healthy healthcare system in that state. We need that not only in Tupelo and North Mississippi, we need it in every sector of the state of Mississippi. We cannot afford not to have quality healthcare, and I said quality, not quantity, quality healthcare in this state. Looking down the road, some people ask me, say, well, what do you have to do with the price of eggs in China? I don't have a lot to do with the price of eggs in China, but I do have a lot to do with the surplus that insurance companies handle from the Russian-Ukrainian venture. We're going to have to look, and I will go back today and look at, we may have to outlaw the use of, not outlaw, but prohibit the use of cryptocurrencies in their surplus because you can't quantify it. We may have to say, and I will probably do this, I'm just telling you up front, we will prohibit the use of international call centers to answer questions on Medicare and other insurance issues. It's something we've got to do to protect the data in this country due to what we are seeing with cybersecurity. And we will do a lot of other things to try to at least negate the negative effect of what's going on between the Russians and the Ukrainians today. Now, I have children, grandchildren in Kazakhstan with the Foreign Service, so I'm pretty close to the problem that's there. I don't normally talk about that, but I would tell you it's a lot more serious to our democracy than we will ever know. Thank y'all for letting me serve as your insurance commissioner. I truly love my job. God bless you and the great state of Mississippi.